disruptive events, and how to build a resilience framework into your organizational capabilities. So I know some of you in the room, but just a quick show of hands, how many of you are practitioners? Yeah.
Can we be both?
You can be both. You can put your hand up twice. And academics. Yeah, so a lot of people are both. Yeah, straddling the two. So this project is really based on an AMI grant that we were awarded. So what happened was, the AMI said to ANZMAC, they want to do more, development stuff, and they wanted to collaborate on that. So, both organizations kicked in some money for this kind of grant scheme. So this idea of, that sort of academic plus industry type of projects. And the truth is, I saw the call for projects 2 weeks before the deadline, and I thought, oh, this is a good opportunity. And as luck would have it, we were funded, and we were the top project as well that were funded. So on the team is myself and Carolyn, who most of you probably already know by now. But we also have Ross Gordon on the team, who was a panel speaker this morning. He's not able to join us in person because his three-year-old is in daycare. So someone has to watch her. We also have Fiona Spotswood, who's at the University of Bristol, and Tracy Bridges, who is from Portchester Consulting, which is in New Zealand. And Tracy is a practitioner that does a lot of policy work in New Zealand. So we were quite purposeful, or I was quite purposeful in, asking each of these members to join the team, because I thought, well, if it's an academic industry type of grant, it'd be really good to have, a mix of both academics and, people working in industry on the project. And because it was ANZMAC, Australia, New Zealand, I thought it'd be really great to get, people from Australia and people from New Zealand. So that's when I picked up the phone and called Carolyn, and I said, oh, are you interested? I know it's a very short turnaround, and she said yes. I did the same with Tracy. It's like, look, Tracy, I really want someone from New Zealand as well, and someone from her policy background to bring that perspective. So the work is still in progress, but what we are presenting today is a framework that we developed from the first phase of the project. So we undertook quite an extensive systematic literature review on the resilience literature. So we were kind of inspired by events like the cost of living crisis and climate change, and those are the contexts that we're looking at. And we were interested in exploring this idea of resilience. So in the marketing literature, a lot of that is framed around this idea of consumer resilience. And, the dominant approach is really from an individualized perspective. A lot of the focus on resilience is, well, what can people do to be resilient? What can they do to try and cope with disruptive events like climate change, like the cost of living crisis? And that was also something that was reflected quite a lot in policy documents. So like in the UK, for example, the UK resilience framework is very much oriented around, individual resilience and building resilience of people. And we thought, oh, there's a bit of a gap there as well, at least, in the consumer research on, systems resilience and community resilience. In other disciplines, there is a bit more of that engagement. So that was something that we tried to tease in a bit more. And the second stage of the project is some focused ethnographies. So we're still collecting data on that. So it's a little bit like what Eric presented about, the middle-aged men, where we get people to film some videos and pictures, and we do interviews with them. So maybe the next conference I see you at, we've got some of those, results to present to you. But in the meantime, this was really, I guess, where we began. So, the concept of resilience came up from the ecological literature. And really it's looking at, the measure of persistence of systems. And there's been a lot of discussion about systems in today's conference, and the ability of a system to absorb change and disturbance and still maintain the same relationships between populations or state variables. And when we look at the consumer resilience literature, there's lots of different definitions. There wasn't a singular universal definition that, was, that kind of encompassing. Essentially, in the consumer literature, it's really about people's ability to either bounce back or bounce forward, after, some sort of disruption has happened. So that's what we were working with. And based on our literature search, we analyzed, the existing, literature. And what we thought was, look, we wanted to come up with a conceptualization of consumer resilience that was more relational to address that particular gap in the knowledge base. We drew from non-marketing literature as well, but one of the things we also did was we drew from the Global South Scholarship. So a lot of traditional and indigenous knowledges as well was integrated into the development of these frameworks. We do have a paper that's got a revise and resubmit at the moment. So again, if I see you again at the next conference, I'll definitely forward that on to you. So our conceptual framework that we came up with, we identified 5 elements of that framework. Politics, perpetuity, relationality, reconstitution, and communitarianism. And we started with politics because, from our reading and our interpretation and analysis of the literature, politics is really what shapes, our environment. It shapes, our responses to disruptive events, and how we try to manage that. And then your perpetuity offers that sort of temporal dimension to that, whereas your relationality and reconstitution are the mechanisms in which, we develop your, resilience capabilities. And through that, the idea is you come up with something that has a more communitarianism approach or orientation. So how Carolyn and I are going to do the workshop is, I'm going to talk through each of the dimensions in a bit more detail. And then Carolyn is going to talk you through an exemplar of how, you can apply this framework to a particular case study. And then we'll do the fun part where we'll get you to work in small groups and, have a think about, what organizations maybe you work in or work for, what sort of projects you're involved in, and how these dimensions might apply to the work that you do. And so, there's no right or wrong answers. What we're really, really interested in is, your thoughts. If there's anything that you think works really well, tell us. If there's anything that you think, oh, it's a bit more difficult to kind of, figure this out, we want to hear that as well. So, what you're really doing is you're helping us come up with something that, we can take to, organizations or people working on, change programs that they can use. So, as I said, the politics is really about the power relations and the activities associated with decision making. So I know Beck mentioned power in the panel session this morning, and Cheryl also discussed, how power imbalances, are something that we need to address when we're trying to, kind of talk about how we manage disruptions. How power is distributed, this idea of status, and again, the distribution of resources amongst different groups and individuals in society. So, when we think about, disruptions like climate change, economic recessions, war, often, our responses to these events are quite driven by the politics and the actions of government. So Ross as well in the panel session this morning mentioned the 2022 federal election in Australia, so that sort of political narrative around climate change saw that sort of swing, from a Liberal government to a Labour government in 2022. And, definitely, climate policy was a big part of that. So some examples of how politics, would play out are deregulation, globalization, the co-option of the state by corporate interests, and the reduction of the welfare state. So some of these ideas, again, were discussed in the panel session, which I think was really interesting. And as I mentioned, the perpetuity of these, disruptions. In the opening session, I mentioned, disruptions are not always, not necessarily one-off events. You can have them, like, the LA fires, but other things like, cost of living crisis or housing stress or poverty, these tend to be, perpetual and ongoing, and, they build, over time. And so perpetuity offers that temporal dimension that calls on us to reflect on the nature of the phenomena that requires resilience, and how resilience is manifested in different ways. So we're looking at resilience as something that's ongoing. So it's not something that we draw from resources at a singular time point, we get over it, and then we move on. A bit like the COVID pandemic. So that's a really good example of like individual discrete event. But other forms of disruptions are a bit more persistent. So, you know, it's also the result of the political environment. So, what sort of, I guess, political persuasion, you belong to in terms of who is responsible for responding to these problems and these issues. What is the role of, individual responsibility versus collective action? And so, we thought that this was an important thing to consider, particularly for marginalized communities or where, consumers, where everyday practices of adaptability to adversity are necessary for survival. So this element of relationality is something that we drew much more strongly from the Global South scholarship. So some of the indigenous knowledges that we drew from were things like the Malay Budi complex, which talked about relationship building and how that's prioritized over everything else. And it really is meant to reflect the interconnectedness of individuals, communities, and systems. And so how, these relationships over time and space, how they evolve, that sort of thing, how they kind of, help us to build resilience. So relationality is intended to help us understand how not just individuals, but also communities and systems interact, and, how we respond to calls for resilience. And in reconstitution, it's really about thinking, how do we reimagine and position, the interconnected relationships between the different stakeholders within a system in relation to calls for resilience and the need for resilience. It's trying to move away from individual responsibilization, which is what's currently promoted in a lot of neoliberal political agendas, while it's about empowering individuals. What we want to try to do with relationality is to draw from, the social and cultural capital that may be there. And if it's not there, how do we build that and develop that? And so in a collective way, how do we transform to respond to challenges and crises? And so communitarianism is really that sort of outcome, after, practicing or embedding, relationality and reconstitution. So it's really the manifestation of resilience and a source for transformative change. So again, looking at the importance of social networks, community support, and how individuals' capabilities are shaped by those forces and how we can shape those forces as well. So I'm going to pass this along to Carolyn now to talk about the exemplar. And this is just a working diagram to show the relationships between the constructs that we've just talked about, whereas Carolyn's going to give you a more, I guess, practical and applied example to kind of maybe solidify your thinking about how this might play out.
Thank you, Nadia. Nice to see everyone. So I am going to give you an example that's related to a fall prevention alliance that we're working with at the moment, based out of University of Sydney, but it's a collaboration across about 35 different groups. And it's including researchers, Rotaries involved, fall prevention societies, government bodies, whole range of organisations, not-for-profits as well. And everyone's got a shared view of wanting to reduce the risk of falls and reduce the number of, not just the risk, the actual number of falls and impacts. But I thought, and sorry, just to explain why I've chosen that, my wonderful team a couple of weeks ago, including Leah, who's here, when we knew this was coming up, we were sort of talking about what would be a good example to share. And when we were talking about the theory, we sort of thought, well, falls are something where there's a compounding challenge. So you start with one thing and someone has a fall and it sort of compounds. So I just will explain. I'm just going to park that for a second, tell you a little bit about me, and I suppose my two links to falls. So as Sue and also as Belinda knows, and some of the others in the room, I started out my professional life as an occupational therapist. Worked for about 5 years and then just didn't really feel in hospitals and clinical settings, and didn't really feel that was going to be my lifelong career. So I went back and studied again, and sort of had more of a business kind of a career, particularly in marketing, and I've run Juntos for the last 20 years. And over time, sort of those two strands have come together. But I think that was one of the reasons, as I was working out what that business should be, and we've come to be Marketing for Good and a lot of work in health, we started to connect with different health researchers and different people working in the space. So we've had a long-term relationship with the Institute of Musculoskeletal Health at Sydney Uni, and some of those, we've got some of the world's leading fall prevention researchers in Sydney. So it's our absolute honour to work with them. But we've got a long-term relationship, which is lovely. But my dad had a fall in 2020. It's COVID. And so, even though I had all this background and I had known that he was he was at risk of having a fall, he was 90. But he's just the classic example of this compounding challenges, because he was living on his own in Melbourne. I lived in Sydney. There wasn't really family support for him. He had to be more isolated because everybody was. So he was just sort of managing, and then just didn't manage, had a fall, and you think, oh well, he'll just be in hospital for a short time and then he'll get out. But then he had to go to rehab, and then it was, no, you actually can't get home. And then he had to go into resi care, and that's not a great experience. You're a fall risk, so don't get out of the chair. So then, of course, when someone doesn't get out of the chair, they lose their physical function, so then he can't stand on his own. It's just, and a very active, capable man, and you just could see this decline. And it doesn't have to be like that, because we know the research. Sorry, I feel like quite a bit of background, but why falls are so important. It doesn't have to be like that, because we have incredible research from the likes of the Institute of Musculoskeletal Health, where we know that we can reduce people's risk of fall if they undertake strength and balance training regularly. They have an OT assessment, we check their vision, we get them off polymeds, etc. So it's pretty frustrating that such a big problem, and it's a big problem. It's not just my dad. It's 1 in 3 Australians over 65 have a fall every year. 365 Australians are admitted to hospital following a fall, and a lot of them don't get home, and sometimes people, they die. Or it really impacts their quality of life. It's expensive. I think it's $3.2 billion a year we're spending as a result of falls. So it's as you'll see in one of my slides in a minute, it's really low. No one cares about falls. It's not in the National Preventive Health Strategy, and there's a bit of ageism there, I think. So anyway, that's the background. But there's a whole lot of people who really do want to do something about it. So so we're working together. We do the marketing sort of work for the Alliance. So we do this. We've helped them with strategy and some of their sort of branding and building them a website and that sort of thing. But we're also trying to support and be part of the Alliance. So that's the background. And then I thought this was a great example to talk today about the resilience framework. And I hope I've got it right. Nadia can tell me. Or you can tell me perhaps. So what I tried to do was think about that work in the context of this framework, and how would it fit and how would it help. So politics, and I whether this is right or not, but I started with current, desired, and then what do we need? What actions do we need to get to the desired point? So currently, as I said, it's not in the National Preventive Health Strategy. Not sure why. There's a high incidence, there's a big cost, and we know how to fix it. We don't know how to fix every fall, but we know how to fix a lot of them, or reduce the risk of a lot of them. If older people do balance training 2 to 3 hours a week, they reduce their risk of having a fall by 37%. So it's not like a 3% change. So what we want it prioritised across all government jurisdictions in policy, because we know that that's the beginning of prioritising funding. So we want adequate funding and resources, and we want prevention prioritised. And that's not just for falls, there's lots of things. And I'm sure lots of you are involved in many related issues. So we need advocacy and comms, and we need that directed to the decision makers. So not all comms needs to be as you all know, to consumers. Then I thought, well, it could be helpful if we say, here's the policy. We've already written it for you. You know, put your letterhead on it and change a few words. So a sample policy and legislation for them. We need to build relationships at all levels of government, because I think, you know, a lot of change comes from attacking things at lots of different angles, and I think building those relationships is important. And then I think, you know, perhaps humanising the problem and bringing it to life. So I thought people with lived experience, let's connect them with policymakers and decision makers. Let's bring them in to meet our government and different people at all different levels. So that was my go at politics. Perpetuity. So the current system is we've got short-term funding, and it's very much focused on tactics from my point of view. There's not an overarching strategy, which is part of the reason why the Falls Alliance has been, I'm not the only one who's come up with that. The Falls Alliance really believe that there needs an overarching and integrated approach, and it needs to be prevention, and then it needs to be treatment, and it needs to be really good pathways for people once they've had a fall. And then we've got all the evidence and it's not applied. So we want a preventive framework introduced where all the risks are addressed. And I sort of thought there was, you know, in terms of this model, we've looked at individual, organisational and societal. So there's individual actions. People can attend be encouraged and shown and know about exercise groups in their area. But then services need to be affordable, and sometimes people need more than just a community group. And then we need awareness raising, and this ties into the stigma. But I think, I suppose from my experience, it's really helpful if you can do it in a positive way, not like, oh, don't have a fall. It's more like, look what you could be doing if you had better balance. So the actions we need is committed funding and consistent strategy, particularly addressing that ageism and stigma, positive tone, comms campaign at all different levels, advocacy, and then I think coordinated, transparent evaluation and tracking lead and lag indicators. Rationality. So currently there's a low focus, but we think perhaps the reduction in the rate and impact of falls via greater awareness and coordinated initiatives, if things are better promoted. So actions could be coordinated development of a strategy. So this is really, I suppose, what the Falls Alliance is trying to do. Develop a clear policy and strategy, coordinating across jurisdictions, developing a central portal for resources and evidence. And I suppose as an aside, that's interesting with 30 groups, you know, different levels of ability to formally sign up. Some people aren't allowed to formally sign up. WA's got a great program. Someone else has got a great program, but you can't change the whatever on it. So, you know, there's the practicalities of working together in an alliance, and what does that look like? So that's been some of the work. Better professional development, so that people really, you know, these kind of the knowledge is translated and put into practice, and then better education of older people and their families themselves, and then we've talked about stigma. Reconstitution, the establishment of the Falls Alliance is desired, and coordination, and then we've got, you know, these different actions, so we've talked about some of these. Community classes that people who are just everyone can get to and access, but then, you know, aged care settings are a problem because balance and strength classes aren't generally provided. They're not covered by anybody's package or funding, so that's an issue to be addressed. Improving access to services when you're at risk, maybe funding for GPs or pharmacies to assess and direct people to services. And there's no Medicare number at the moment. So this is another thing around funding. There's not adequate funding for prevention in the community. So that could be something that could fit under reconstitution. And then communitarianism. Some of these, there's sort of a bit of an overlap, but the current is there's low awareness. So we want to awareness, stigma, and easy pathways to programs. And then the actions the campaigns, the unified point of information, centralised shared resources, and that this sort of point about the time frame too. I was talking to somebody else about the short-term time frame. I think it was Maria, and that just really has an impact on the efficacy of programs. So, how can we build in a longer-term time frame? I hope I've done the model justice, Nadia.
Thanks, Carolyn. So, we've kind of really just given you a very, very brief overview of, what this framework we think might look like, how it might apply to this particular, exemplar that Carolyn's talked about, with falls risk. And really what we would like to do today is to kind of workshop some ideas with you, on how this framework might apply, in different contexts and in different scenarios. So, you'll see that there are some Butcher's papers on the tables. So, what we would love for you to do is at this stage to really work in, small groups. So I know that the room's not really set up like the ballroom, and they did warn us that we can't move the tables, otherwise we'll get charged extra. But, if for those of you who might, be sitting in different rows, if you are happy to turn your chairs around or work in pairs, that sort of thing, we'd love for you to maybe, first of all, talk about, where do you work? What kind of work do you do? What are some of the issues that, generally you address in your line of work? How have different types of disruptions, impacted and influenced the work that you do, that require resilience? And then what we would like to see, if you could pick, one context, one organization or one example, maybe something that somebody in, your group or in your pair is looking at, and apply the framework using the format and the exemplar that Carolyn talked through. So what is the current state? What is the desired state, and what you think actions are needed? Then Carolyn and I will, come around and have a chat with each group. So that would be really great. So, yeah.